Hello, everyone. My name is Nayeli Alcaraz, and this is my case study presentation. The case I chose is Woman Sues Dentist After Getting 4 root canals, 8 crowns, and 20 fillings in one visit. So the article summary is a patient named Kathleen Wilson is suing her former dentist, Dr. Kevin Moldrum, for negligence and claiming that he caused her pain and suffering, embarrassment, emotional distress, and disfigurement. The reason for this is that while being treated under the care of Dr. Moldrum, Kathleen had 4 root canals, 8 dental crowns, and 20 fillings, all done in one visit. Due to all these procedures being done all at once, it caused Miss Wilson severe pain, which kept her from obtaining an income. Miss Wilson also contends that Dr. Muldrum misused the amount of anesthesia he gave her. She claims the amount given to her was more significant than the recommended amount to be administered. She also claims that Dr. Muldrum falsified the documentation of her medical paperwork for the medical records to state that he administered the correct dosage of anesthesia. Kathleen is asking for more than $50,000 for all the damages caused in her life due to this unfortunate situation. Dr. Muldrum claims that the dental work he gives to all his patients is the same type of dental work he would give to his own family. Dr. Avram Goldstein, whose Miss Wilson hired to review the case, stated that restoring all of her teeth does nothing to address her susceptibility to her disease, the likelihood of it continuing, and the possibility that her teeth will be lost. Therefore, this shows the negligence of Dr. Muldrum in treating Miss Wilson in a manner that would be better for her oral health. No treatments were done to keep decay and erosion from continuing to happen. Instead, Dr. Muldrum tried to fix all of Kathleen's oral issues in one visit. According to Dr. Avram Goldstein, attempting to complete multiple procedures in one day is impossible and leaves little room for accuracy. Dental procedures must be done in a manner in which safety is a priority. Doing all of these operations at once costs more than the safe amount of anesthesia that should be used, putting Miss Wilson's life at risk. The American Dental Association is very much aware of this case, but has decided not to make any comments. The ethical dilemma. So the code of ethics that I chose. I apologize if I mispronounce any of these words. Non-maleficence, which is the obligation for any healthcare provider not to do any harm to the patient. In this case, Dr. Muldrum did not oblige to this ethical code because he did excessive treatments on Kathleen Wilson, causing her actual physical harm and pain, and also causing harm to her in different aspects of her life, such as affecting her ability to work, disfiguration, and more. Another code I chose was beneficence, the principle in which any healthcare provider must act for the benefit of the patient and must protect and defend the right of others, prevent harm, help people with disability, and rescue the patients in danger. I chose this code because Dr. Moldrum broke this ethical code because all he did was provide Miss Wilson with temporary solutions, which caused her a lot of pain and suffering. He did not properly think of Kathleen's benefit and treat her actual gum disease to prevent the same issue from occurring. And he did not provide a safe dosage amount of anesthesia, which all these things put her health in great danger. Another code that I chose was veracity, the principle of telling the truth. As a dentist, Dr. Mojum knew very clear that giving Kathleen all those procedures would not improve her oral health because he was not treating her gum disease at all. He should have been honest with Miss Wilson and treated her gum disease first instead of giving her temporary solutions that would still result in her oral health not being helped at all. So for my discussion questions, I chose, did Dr. Muldrum do all the procedures with the better intention of helping Kathleen and her oral issues. I also chose, should Dr. Mojum's dental license be revoked due to this case? Why or why not? And would you consider Dr. Mojum's actions as lazy and irresponsible as a dentist, or was this just an honest mistake he made? Please explain. Thank you.